All right. Hey, good morning, everybody. Good afternoon, depending on where you're tuning in from. Appreciate everybody taking a little time here on their Thursday and Thursday leading into a long weekend, no less, right? So hopefully this is kind of a Friday out there for some of you if you're gonna, take off early or those kinds of things. At any rate, I'm really excited about this live today. I've got somebody on here who's become a fast friend of mine. I met just a couple of years ago at a conference, and particularly for the HR people that are in my sphere of influence that are part of the audience here. I'm really excited for you guys to hear from the one and only Stephanie Koch today. Stephanie is somebody again I met at a conference a couple of years ago, and the more I kind of heard her talk, I thought, wow, this is somebody who knows more about self-funding and level funding and the benefits of it and the different things that you can do to construct a plan that's built for the 21st century that is where you're eliminating employees out of pocket expenses, you're guiding them to higher quality health care, you're creating a bottom line impact for the organization as well as for each and every employee that participates in these plans. And then ultimately, you're taking work off of the admin and the HR team's plate through that process. And I just kind of thought to myself, how is Stephanie not a broker, not a consultant? And because again, just because of the knowledge and experience that she has, and so that's why I'm so excited to talk with her today because she kind of filled me in as we got to know each other on her hero's journey, right? Where she was not ready to get into this to leave her very comfortable, familiar surroundings and environment and go off into onto this new campaign and find a new way of building a 21st century health plan. So I'm very excited to be talking to Stephanie today. And Stephanie, if you would just give yourself a little bit of an introduction, more than I just did, kind of fill people in on where you're at and what you've been up to, and yeah, like I say, just very excited for this conversation today.
Well, I really appreciate the kind words and introduction. As Chris said, my name is Stephanie Koch, and I'm the Director of Human Resources for Hendry Marine Industries. And I've actually worked in HR almost 30 years. Throughout that course of time, as everyone does, they progress in their career and learn different things. And, the HR field is so demanding and it's almost a thankless job. So, through those years, a lot of them I spent in companies that were fully funded and then went to a company that was self-funded, and the thought of going from one to the other was frightening. But I made that transition, and then we made another transition, which I know we're going to get into. But there are definitely two things I never thought I would say out loud. Number one, sure, I'm going to speak in public. Like, the thought of that was terrifying 2.5 years ago, but yet here I am. And the other thing is, God, I love talking about healthcare strategy because I know a lot of HR people like myself, because we do so many things in the day in and day out, when it comes time to open enrollment and you have to deliver bad news to your employees because most likely your premiums went up and your plan design got cut, it's
Hmm.
just, it's not fun. And that's why when I really started learning healthcare as a new concept and a real strategy, I got really excited. And it's been almost 10 years in that space. So I'm looking forward to having the conversation.
You bet. Well, let's go back to what you were just mentioning there in the beginning, and I kind of touched on there briefly too. Was that you had this fear and this apprehension, and I mean, I guess obviously people know by the title of this that's kind of what we want to focus on at least initially. And so, talk about you had that fear yourself, and
Absolutely.
so talk about that initial fear that you had for doing something different, for looking at something outside of what we refer to as the bukas, or that traditional market, the fully insured market, or what I think most people are used to, that legacy way of building a health plan, which is just simply picking one off the shelf from a carrier, their plan design they give to you, their network, you're just you buy that product and you've shifted your risk to the insurance carrier. And I think that that's something that's been very common. So talk about that fear from just kind of picking something off the shelf to making that strategic decision to look at something outside of what you'd seen over the years and potentially over the decades, really.
Yeah, so like I said, worked in fully funded for a long time, went to a company that was self-funded. It was a family-owned business. They had about 450 employees, about 600 covered lives on the plan. And when I was moving to the company, I was first afraid because I never worked in self-funding. And I remember hearing about it, and it almost seemed like it was scary, but I didn't know why it was scary. But when I started working at that company, I was like, oh, okay, so our plan's basic, it looks and feels like a fully funded plan. So
Mm-hmm.
it has the same appearance. There's nothing different to your employees. So to the end user, they don't see anything different. The mechanics are a little different, but what happened in that case was about 3 years after I was with that company, we got an 18% increase with one of the bukas, and because we're a family owned company or any company, that's almost unsustainable. That's a lot of money that compounds year after year. So, unbeknownst to me, some of the people on my leadership team went to a benefit education session and they came back to me and said, hey, with this 18% increase, we decided to go to the session and we learned about this concept called reference-based pricing, and here's how it works. Well, my first response to them was, you guys are absolutely out of your minds and there's no way that's going to work. I was not having it. Because my initial fear was, what is it going to look like? How is it going to affect the employees? Like, that's great, the company's going to save money, but I'm very protective of my employees and what we're offering. But once I decided to become open-minded, well, here's the thing, and I forgot to mention this, Chris. So, and I know every HR person on this call feels like this. Like, we innately know there is something not right because when you get your renewal and you're getting an increase in premium, but you're not able to validate why, there's something wrong there. And I always felt like I'd never understood it. So when I finally decided to start investing time learning about, I call non-traditional healthcare, so it's outside the BUCA traditional space or legacy plans as you called them, it was very eye-opening and I finally started understanding what I had been missing all those years. So it was a phenomenal learning experience, but the important thing is to really just become open-minded and believe it's possible.
Right, right. Well, and a lot of times, one of the major barriers, objections, hurdles that we have to come over on my side of things when engaging with HR and finance and just the decision making around this thing is what something that you touched on, which is that employee noise, where it's like, hey, I
Mhm.
don't care if this is going to save everybody a bunch of money. Like, good for you guys. But guess who's going to have to hear about this when things go sideways,
Exactly.
or when someone's confused, or
Mhm.
when what who knows, there's always going to be there's well, first of all, there's going to be people upset if you don't make any changes, and there's going to be people that are going to be upset if you do make changes. So it really is, you're really trying to thread this needle constantly. So talk a little bit about some of that employee noise and how that factored in perhaps to some of your fear and apprehension around making this transition, making this change.
Well, I first want to talk about the fact that we were with the same broker for a long time, and I still consider them brilliant. They're still friends to this day. But what happened was it was a different broker that presented us with this option. And we did end up switching brokers, and it was difficult because, HR, I had a great relationship with them. I didn't know what I didn't know. And somebody else presented that option to us, and we did, like I said, we ended up switching. And throughout that journey, and I call it a journey because it was learning something totally new, it was scary because I always want to make sure that what we're presenting is something that, number one, there were two of us on the HR team. Could we handle the administration of this? Do we understand the change well enough to execute a strong communication plan? and strategy, and then, what's this going to look like in the coming years. And because we had a really strong support team, we were very diligent in putting together a very comprehensive communication strategy that really helped the employees become engaged, not only what it was, but why we were doing it. And that was really important. And what was interesting was everybody understood, because I don't think there's anybody that would think healthcare is so great and why would we change it.
Mm-hmm.
So our
Yeah.
employees were really on board because of the way we laid it out and how we got to the conclusion that this would be a great program for us to adopt and move forward with. And it really was.
Yeah, no, I think that makes a lot of sense. I mean, that we've seen that too, just in the communication strategy we use today with clients, where a lot of times we'll get it is that kind of that why behind
Mm-hmm.
the why you're doing this, right? Just like you would explain any other kind of change within your business, or to the way that, if you're rolling out I don't know, a new payroll software, you're rolling out some kind of new software to your employees, or a new tool for them to use, or what have you. There has to be some kind of education around, why we're doing this, how this is going to be a benefit, and why wouldn't you approach your health benefit with the same focus? And so a lot of times what we do is, we obviously make this optional. We don't force anybody to do it, but typically we get somebody. Typically it's an HR person, or many times it's the CFO, or maybe even the CEO themselves. We typically will provide them a script. They can ad lib a little bit if they want to, but
Mm-hmm.
we don't want to be the ones telling them about all these great things as part. They don't know me from Adam, right? But they do know their CEO. They do know their HR person. They do. There is some kind of champion there for the employees within the group. We have them record a short video, where they're explaining, "Hey, we're excited about this. Here's why. Be sure to look at this link tree, or look at this site, and it has all the information. You have links to, all these. So we just have them lay it out." And in fact, that sometimes is something that, again, puts people at ease, and it's a familiar face that they know, who's explaining to them why this change is happening, just like you would for anything else you're doing inside of your business. So
Yeah.
I love that you said that, is that you really focus on why we're doing this, not just like, here it is, which is what in the past, when
Yeah.
your only option is to pull that plan off the shelf from the carrier, and okay, your deductible's higher, your out of pocket's higher. By the way, we're going to need to the premium went up, so you're going to have a higher amount being withheld from your
Yeah.
check. Like in that case, there is no why behind that. It's just, this is the most expedient thing for us to do, and then we need to move on to the next project. So,
Well,
um,
and the other thing I wanted to mention is that, let's not kid ourselves. No matter what kind of change it is, you can move from Aetna to Blue Cross, Blue Cross to Cigna, Cigna to United, or whatever it is. There's always some type of disruption. It's
mhm.
really a matter of getting in front of it and really having a good plan and a good broker partner like yourself, so you guys can anticipate to know what needs to be done, so it minimizes that noise. And it is important also because HR is so important in the change management process,
Mhm.
especially communicating something like this, that everybody from the executive leadership team or whoever is in charge of making this decision is all collectively in agreement that this is the right thing to do. Because if it's misaligned, then it could really fail.
Mhm. Oh yeah. Yeah, absolutely. And so let's talk a little bit about, I know when we were talking off air, you were saying how, this, it wasn't like, okay, so you were kind of shared already with the audience today what that process was like, but it's not as though that happened, overnight, or in a week, or a couple of weeks, or a couple of months even. Tell me a little bit about, I want to really drill down on that timeline of what what got you from the point where you were so afraid, where you just said, no, this isn't going to work, to the point that you said, yeah, this actually could really be a great thing, and I'm going to be a champion for it. What was that timeline look like? And what were the steps along the way? How did you educate yourself to then get comfortable with that idea?
Well, believe it or not, it wasn't as long of a timeline as you think.
Okay.
Yeah, because we were a September 1 renewal. And I
Okay.
think we got our information for renewal in like May or June, I want to say. It
Okay.
was pretty quick, quicker than most cases. But again, the 18% increase we got was
That's a
really not
motivator.
something we could wrap our heads around. And when it was first brought to my attention, I'm a show me person, so they could tell me anything they wanted. But in order for me to really buy into it and make sure I felt comfortable with what we were going to present, I needed to see how it was going to work. Because again, every HR person understands there's something going on in the healthcare system that keeps driving premiums up. And in my case, I was like, all right, well, we had an EOB from someone that had a CT scan. This is one thing I do remember. And I said, here it is from company A, one of the big carriers, and I want you to run it through what this would look like under your program with reference-based pricing. The price was significantly different.
Hmm.
And right then I said, oh, and I started putting I started putting the thoughts together about what was really going on. And that was the first thing that made sense to me. And then I learned about auto adjudication of claims. When you're working with a big carrier, no one is looking at your claims for the most part. They're processing claims. And in this new model, somebody would be looking at the claims, making sure that what a company was charged, or I'm sorry, a member was charged, was actually what was, or what happened.
Mm-hmm.
So, things like that. And then just meeting the team. In our case, we work with Imagine 360. I've been working with them for 10 years, coincidentally, with my last company and this company. And understanding their whole support model, not only for HR, but really for the members, it was extremely better than what we had been receiving support-wise from the big carriers. You know, I think we've learned to call it sick care instead of health care. It's
Yeah.
unfortunate.
Indeed. Yeah. No. Absolutely. Well, and I think that sometimes is where there's been there's this thought process that bigger is always better, right? And that well, we're working with one of the big carriers. Their name is on a sports stadium, and there's the but
So not
when
true.
you no, it's certainly not, and we always like to point that out too. Is it's like, look, these are all very large, publicly traded companies that their fiduciary responsibility is to their shareholders, not to their
Exactly.
policyholders.
Exactly.
And you mentioned the auto
Hmm.
adjudication. There we go, got it out there.
Yeah.
The auto adjudication of claims is something where yeah they're not
Nobody
watching
looks.
and no, not at all, not in the least. And in fact, because of the ACA and the medical loss ratio provision in that, their incentive is to grow to spend more and more on claims each year. So the more that you're spending in claims, the more you're spending at providers' offices and hospitals and facilities and et cetera, the more they're able to actually grow their profit. The more they're able to grow that margin, because otherwise, if they're outperforming some of their peers in the same marketplace because of that ACA loss ratio provision, that delta ends up getting clawed back by the federal government and then redistributed to their competitors. So it's a punitive thing for them to run better than than their competitors. And it's just again, anybody who's on this call, just think about that in your own line of work. If you had to give a piece of your profit margin to your competitors because of this regulation that came into effect, what would that do? How would that change how you operate? Well, of course, what you would do is you would charge your customers more because that would be your, one of the main ways that you would be able to grow, in addition to continuing to issue more shares. So, anyways, I digress there a little bit, but
Okay. I
um,
wanted to mention something also about the first year, and again, this is back in 2016. So this is way back when I first learned about reference-based pricing and a true self-funded program that a company has the ability to create to really meet the needs of the employees or the members, not necessarily, like you said, something that is on a spreadsheet and you have to pull it off the shelf and you only have two choices.
Right.
So that was really awesome because we were able to take the plan design we had before, and the first year we used the same plan design just for purposes of being somewhat conservative, because while we anticipated we were going to have savings and we were going to have a great outcome the first year, you just never know. And it was great because we were able to keep the premiums the same, we kept the plan the same, and we actually saved $1 million the first year. And because we had so much in savings, we were actually able to, this year two, change the plan design to be more beneficial to the employees. So we dropped the max out of pockets, dropped the deductibles because they were not spending as much out of pocket. So it gives you that freedom that I know I always wanted, and I always felt, why can't I do this? But you can. And that's the nice thing, is you're able to put a plan together that meets the needs of your employees. And more importantly, having access to the data that's driving the claims and seeing what's happening inside the plan so you can actually come up with a strategy behind what you're doing. So
Absolutely.
that was critical for us.
Yeah, oh, absolutely. And it's just one of those basic laws of economics, which is just simply incentives, right? The employees are going to act in their own best interest, their own financial best interest. And if that includes, engaging with the plan the different ways so that they can eliminate having to pay their deductible or co-pays or out-of-pocket maximum or whatever it is,
Yeah, it can be
99
done.
times out of 100, that's what they're going to do. It's an easy choice, right? We've
Mhm.
got example after example, case study after case study where where we do it's well, show me how this works. Show me an instance where this has benefited the end user, and again, it's just simple incentives and aligning those with the employees. And then as you just mentioned too, you guys saved $1 million in the first year, and you said this was on a plan that had 600 lives covered, 450
Hmm.
employees, 600 total. So I
Yeah.
imagine your spend was probably somewhere around the $5 million mark, right? Or
I mean, this is almost 10 years ago,
okay.
but I mean, to have that kind of savings in the first year and then being able to reinvest that savings into
Yeah.
creating a better plan and offering it was unheard. I was like shocked because I, again, initially was very skeptical, but then I decided to jump in, and
Yeah.
I'm really glad I did, because then moving to 2019, I ended up leaving that company, and I came to Hendry as a contractor, a fractional HR director in December of 19. And what was interesting is they had just completed their first year with Imagine 360. But Hendry's story is very much the same as what I'm sure a lot of people have experienced. So they were fully funded for many years. It's, again, a family-owned private company. And an increase came in. Again, it was, this is not sustainable because that increase compounded year after year.
Hmm.
Companies should not have to plan to have increases every year. I mean, but the point is that back in 2017, 18, they started transitioning to self-funded. 19, they finished their first year with Imagine 360, which, it is self-funded. They're the plan administrator with the reference-based pricing tools. And because the decisions were made for 2020 when I got here, I did have to wait and ride the plans out for 2020, but in 2021 we did make some changes. And the first one was, which was interesting because they were, self-funded, reference-based pricing, but they had the CVS Caremark PBM.
Okay.
And
Good. I knew you were going to get to this.
yeah, having the knowledge of, prior experience in the company I just came from, that was the first change that I made. And first of all, my fellow HR professionals on this call, I will say, having the authority over a healthcare plan, because I understand it from a strategic perspective, I was basically handed the plan when I got here. And, I have conversations with my leadership team, but, getting to that point in your career and, being the lead on something so important that drives such impact for the employees and the culture. I mean, that was a huge win for me as a professional after so many years. So I say all that because making the recommendation to change to a private PBM outside of the BUCAs, making that one change, we actually saved 30% of our cost for our pharmacy benefit, and we actually increased and enhanced the plan for the employees.
Yeah. Well, and I completely believe that. And I know that came up when we did our recording at the beginning of the month to promote, today's show. And is that, and again, I want to underline this because we did this on the recording if people saw that
Yeah,
video, but you saved 30% not on the drug spend by changing the PBM relationship and removing it from one of those big three, CVS, Express Scripts, and Optum. You saved 30% on the total cost. Now, if we go back to just, I want to drive this point home because it's important. We talked before about in the beginning, it's like, HR, like, hey, look, I don't care about saving money. I care about employee noise. You got to the point with that other company that you saved them $1 million in the first year. I have to imagine, based on the size of that group, that the spend was conservatively somewhere between maybe $5 and $6 million. So in the first year with that company, you saved them 15 to 20%, while you still had in place 15 to 20% of the total benefits cost, while still
hmm
having in place one of those previous, one of those big three PBMs. You go to this new company, they already have the solution, the Imagine 360 that you were using there in place.
yep,
And just by changing that PBM, just by taking CVS out and putting in something else that was a pass-through PBM, fiduciary PBM, they go by a number of different,
right.
transparent PBM, they go by a number of different descriptions. But essentially, you were able to save 30%. So
Mhm.
more than what you were able to save at that prior company by
Yeah,
making that change, just by changing that PBM
pharmacy.
relationship,
hmm
which should underline and I think you would probably agree with this. Tell me if not, but the changing the PBM relationship, most of your employees are not even going to notice that.
They're
Um,
not. And I'm glad you said that because I know, my experiences are very unique in the sense that a lot of companies are not going to go from a a Buka relationship, fully funded or self-funded directly to reference-based pricing and go all in as their only
right.
plan options. It's a stair stepping, and most of the time, it's okay. Let's swap out the PBM first. But to your point, because it has the least disruption, because the members are not going to do anything different other than have a new logo on their card. That's
hmm
it.
Yeah. Well, and if anything, the only way that they would notice it is that suddenly, oh, so I'm paying less for my generics,
hmm
I'm paying less for my brand drugs, or if somebody's on, God forbid, a specialty medication, they might be able to get that completely free.
Yep.
Or, anyways, that's the only way they would know that there's any difference, but they're not necessarily going to notice, again, like you said, unless they
Mm.
look at that ID
It's
card
the
and see
least
that there's a.
disruptive thing.
Yeah, yeah, far and away. That's certainly been our experience too. Um, and so yeah, to save 30% on the plan, just by changing that relationship, I mean that's a huge number, right? And that
It
really
is.
opens up some other possibilities for what you can do for that with that money, right? There's a number of things you can do. So I know that what you did and what you advocated for was to make some additional enhancements beyond doing a reference-based pricing plan, beyond changing the PBM. So what was the next step? What did you do after you had created that amount of savings?
So I wanted to also mention, because again, it's a stair-step process, but when I came in 2019, we actually ended up doing a dependent, I don't think we talked about this, we did a dependent care audit in 21, I want to say. And what was interesting was there were over 30 people that were on the plan that shouldn't have been.
Yep, yep.
And we used a third party to do it. And I'm like, well, we saved over $100,000 according to the administrator that helped us with the audit, because we don't want to pay for claims for people that are not qualified dependents.
Right.
So I really strongly recommend a dependent care audit, if you're self-funded. But then we also, at the end of 21, we actually had $1 million of surplus. I think that's what you're referring to.
Yes.
So that essentially means we over accrued for our healthcare costs for that year. So based on what they were expecting the max funding to be, it was $1 million below that. So we were able to use that money and invest it into an on-site primary care clinic. And here in Florida, it's called Walk-On Clinic. I love giving them a shout out because they're amazing.
Yes, Chris Yarn is an entertaining guy, that's for sure. Yes.
And I just love working with them, because in the middle of 21, the reason this all came up was because, again, we had access to all of our data. And, at this point, I'm a few years into this new healthcare strategy mindset, and I had completely done a 360 about how I used to feel about it. And I'm looking at the data and I'm like, oh my goodness. Like, we only had 15% utilization on our preventative wellness benefit. Now, I work at a shipyard. It's 320-ish employees. We've grown a little bit over the last few months. 80% of them are men, late 40s, early 50s. And when I saw that low utilization of preventative wellness benefit, in my mind, I'm like, oh my God, we have a bunch of walking, ticking time bombs walking around the shipyard, because unfortunately, like it or not, a lot of men don't like to, go to the doctor.
It's true.
They don't want to use PTO. They don't want to, take the time to go. And a lot of times there's access issues. Huh?
I said rub some dirt on it.
Or pretend it's not there and it'll go away. Yeah.
Right, right.
So that was very concerning to me. So immediately I'm like, we need to do something to provide access to care for the employees. Then learning we had the surplus, we were thrilled, and we said, all right, we're going to invest in an on-site primary care clinic. And our goal is to get as many we need to get that 15% number up as high as we can. And we ended up investing with Walk-On Clinic. And, the first year we had them here 1 day a week, because we needed to see the utilization. We wanted to make sure that the employees wanted to use it. And they did, and within the second year, we ended up increasing to 2 days a week. And what was interesting was, it is an investment. It's an investment that we as a company decided to make in our employees and their covered family members. So we said, we're not going to, when you're creating a plan like this, you want to create it so it's accessible, but also people are not going to be apprehensive to go, and you don't want to create barriers to care. So with those things in mind, we made it available to employees and their covered dependents, no cost, and they don't have to go on company time. They go on company time, so this way they're not having to clock out to go to the doctor. So it's just been an extraordinary experience, because what they've done is helped us customize the needs at the clinic based on our healthcare claims data. Like, we have 10% of our employees are, our population are diabetic, so we put a heavy emphasis on our diabetes and whole person program through the clinic and through other means of communication. But again, it's because we have the data, so we know what levers to pull. So that's really been a tremendous success for us.
Wow. And I don't know if you have these available or if you just ballpark, but what have you seen? You mentioned there was 15% of people that were using that preventative service visit before. Where is that now, if you could?
So we're between 50 and 60%.
Wow. I wasn't expecting you to say it was that high.
Oh yeah. And
yeah, that's phenomenal.
What's even better is when we saw the utilization grow, and I can't remember if we talked about this story or if I have time to tell it, about the people not wanting to come into the clinic.
Please do. No, we have time. Absolutely.
So this is actually one of my favorite career stories, because, we literally save lives here. So I know a lot of you don't know me personally, like Chris does, but I'm an optimistic person. I love what I do, and I love my employees, and we're bringing this clinic on site in January of 22, and all I'm thinking is, okay, we're going to bring us here, and everybody's going to use it. Well, no, they didn't want to. because they were wondering, why does the company want to know about my medical history? I'm not going there. That was the initial response. And I'm panicking because I'm thinking, I've got all this stuff prepared. They're here now. So I'm thinking on my feet and I'm like, all right, well, we're going to host a contest. Literally making this up as I'm going along. I'm like, well, from January, I'm not joking, from January to the end of April, any employee that goes for their preventative wellness exam is going to be put in a raffle to win a week of PTO.
Okay.
So what happened was the employees were like, oh, I can win PTO, so I'm going to go for my preventative wellness exam.
Using incentives. I love it.
Well, that was a big one because we had to get people there. It was a big enough investment, but they had to believe it was for them and not for us. And we had a couple of employees go in, and this one gets me every time. So again, they're all trying to win PTO. And one guy goes in, and the doctor says, did you know you had a lump in your neck? And he actually had stage 4 cancer. He had no idea. And had that clinic not been there, don't know what had happened. But he's alive and well. I just saw him today.
Wow.
Yeah, and yeah, I get really choked up every time because he's been here a long time, wasn't taking care of himself, and had no idea he had cancer. We had another employee go in, and his blood sugar was so high, he almost had a stroke, and right away they get him on the diabetes program, and then they're managing his care. So those two employees became the biggest cheerleaders, and then they're telling their other guys like, hey, you need to go to this clinic, they saved my life, or they did this for me, or they did that for me. And it's really just been incredible. We have people that, because with the PPO model or any of the models with the commercial carriers, they're fee for service, they turn them and burn them, right? So there's no personal relationship, there's no continuity of care almost. And here, they have their doctors here. Now it's Tuesday, Wednesday, and they love going. They love seeing them because they know they're being taken care of.
Yeah. Wow. And that's really really powerful. That the fact is that, well, and hopefully one of those two guys was the one that won the extra PTO. I don't know if that's the case or not,
No,
but but
no,
hey, I mean,
unfortunately
even if they
not.
didn't, they're still here, right? So that's, I think, a testament to, and I love your creativity there to say, hey, we made an investment here. Yeah, we had all this savings, but we are also seeing kind of a weak spot. We want to reinforce that area with something that we think is going to
Yeah,
work in the form of the walk-on clinic, and and you were able to do so, and by using a creative solution to get people to start using it. And that's what we found too. A few other case studies and examples that I have as well, where we've helped people get life-saving care. They didn't realize something.
yeah,
It seemed like a small issue, but these things tend to snowball into the point where they become an avalanche. And the fact
really.
is that he was, in both of those cases, those guys were able to get in and get that care that
Yeah.
ultimately, as you said, ended up saving their lives.
Yeah,
Um,
and really it's a win-win because, not only are we taking care of them, but they're staying here on site. They're not having to leave for 4 hours or 8 hours. And, we're only 300 and something employees, but we saw the need just because of what the data was showing. And we want people to take care of themselves. And the initial concept with the on-site, what they call it direct primary care, or in our
yep.
case, it's, on-site care, but, it was preventative wellness. It's just morphed and evolved so much because they're so flexible to meet the needs that we have. And we've been doing blood work. We do EKGs on there. We have a pharmacy program where we have a local pharmacy that will deliver medications, and there are no costs to the employee for 90-day fills. It's again, like, my mind has completely shifted and changed about what I think about how a healthcare plan should be, and I can't remember if we talked about this, even like access to care, where, I used to think high deductible plans were wonderful. Well, no, they're not. And this is just my opinion. Because when you have a high deductible plan, most people don't have the money to meet the deductible to access care. And what it does, it actually almost creates like being functionally uninsured. That's the word I use. And I've just learned so much by hanging out with people like you, Chris, and all the people at the conferences. Like, I have really changed in the past 2.5 years since I started speaking. I've learned a ton, and I'm very grateful.
Yeah. Oh, absolutely. Yeah. Well, and there's a couple things I want to touch on there that you just mentioned. One being that just I guess what all of these things that you've learned along the way. So, what do you see as potentially the next step, right? Like you've done a lot in this period of time,
Mhm.
and again, and we're going to get to this too. We've got still have about 20 minutes left, so I definitely want to talk about what you're doing today and speaking from stage and all these things because you really are an amazing advocate for HR people to say, hey, look, get out of your own way. And so I do want to cover that, but what do you see as potentially the next step for the plan? What's maybe something that you've got your eye on that you're looking to do a further enhancement to what you
Mhm.
guys are doing now?
Yeah, we started talking because we actually had our Q1 review, and that's the other thing is HR folks. We have the right to demand, transparency in what's going on in the plan, from our insurance advisors. Make sure that they're working in your best interest and not in the best interest of their company. They have to get to know you as an organization, the kind of employees you have, what, your company will benefit from, no pun intended. And I say all that because, we are looking at making wholesale changes in our plan design. And, I don't want to go into detail, but, making things like $0 or very minimal cost for access to care for things that we're seeing as problematic in the healthcare claims. Right? So if you see something as problematic, you have the ability to solve that problem. And it's working with people like you, Chris, because you have a lot of this great experience in these, outside the box healthcare strategies and, working with people that are going to problem solve for you. We're looking at with the walk-on clinic, they're incorporating some new data software that's going to give us even more analytics and data on not only what's going on with the existing patients, but anybody that they see moving forward. Are there things that are risk mitigation strategies for their health? So really
Hmm.
getting ahead of things sooner, because once something happens, it's too late. So
Right.
really, our goal is to do it at the preventative level.
Yeah. Oh, absolutely. Well, and there's so many new
Mm-hmm.
softwares out there and these wearables and stuff, Apple
But yeah,
Watches and Garmin and all these things. There's so many things that we do now to track our health and our steps and our heart rate and our sleep patterns and all those kinds of things. And yeah, we can certainly factor all those things in and help, live, longer, and just healthier lives and so on and so forth.
yeah,
So one thing I guess I do want to ask about too, I was going to go here earlier, but we got sidetracked with something else. And this comes up a lot with HR, and especially these days, is recruitment and retention. So what have you seen in terms of like using this health plan, and in terms of being able to recruit employees to come work with you, or also just retaining the folks that you have currently?
right. So I can't say that we have data surrounding that per se right now, but I will say that we have employees that because we have the clinic, that is a reason that, they love being at the company because they've said, we never had a company that cared so much about us that they brought a doctor on site to take care of us, or we have people coming in for tours or coming in to look at the company and, we're one of the only companies in Tampa that has a primary care doctor on site, for the size we are. So it's definitely something that we're working towards to become a destination employer, you
Hmm.
know. But we work in an industry, it's very difficult to find skilled welders in the maritime industry trade and pipe fitters and ship fitters and stuff. We're kind of in a unique spot, but I would say that the employees do love having them here.
Yeah. Oh, absolutely. Yeah, and I would have to imagine, even though you don't necessarily have, hard numbers around that. I would imagine that, and we've coached some of our clients to do this too, where it's like,
Hmm.
hey, just do an A/B test of next time you're doing a job posting, post, hey, we've got medical, dental, vision, 401k, PTO, whatever. And
And a
then
free
over
medical
here,
clinic.
yes, and then over on the other
Yeah.
side, then post brag a little bit about the health plan, the zero deductible, the walk-on clinic in your case, and others, and see which one gets more attention. In our case, we've seen it's been 3 to 4 times those ones that really highlight the
Yeah.
benefit plan are the ones that get far more attention and get people to respond to and send in resumes or reach out or whatever your process looks like. So,
Yeah, and
um,
I think that when I think about like the workforce now versus what it was, 25, 30 years ago when I started in HR, we have three or four different generations of employees, and
yeah.
having the ability to say, okay, well, we have the ability now to serve employees at every generation. So where one thing might be more important to the boomers, well, working on a fertility program for people in a younger generation, those are things that, we can think about now because we have the ability to customize and integrate things that had we still remained on the other plans, we wouldn't have been able to afford them.
Yeah. Yeah.
So I
Oh,
think it's
absolutely.
important to look at it that way too.
Yeah. Oh, absolutely. Yeah. No, that's a really good point in building a 21st century health plan. And I hadn't even thought about that until you just said it. But is in building a 21st century health plan, yeah, you do at this stage still have boomers that are working, and yet you've also got what Gen Z, I think, or whatever. It's like you've got all these different, very very different priorities, very different ways of engaging with their employer and the way they want to go about their work and what they want out of not just
Hmm.
their working life and their career, but what they want out of life in
Yeah,
general.
it's not a
Um,
one size fits all anymore, and this gives you the freedom to build a plan that is suitable for the employees of your company.
yeah. Oh, indeed. Yeah, absolutely. Um, all right. Well, cool. Well, we've got about 10 or 12 minutes left here, so I want to cover this other aspect of your career, which has been, again, where we met, was at a conference that you were on a speaking panel for. And this has been kind of not even kind of, this has been a regular thing for you now over the
Yeah,
last, all going on 3 years at this point.
yeah.
So tell me a little bit about the conferences that you've attended, who's invited you, and I mean, you've really kind of become a who's who for people talking about these 21st century modernized health plans, and from your perspective, having put it in place from the HR perspective. So I think it's really valuable for HR people to hear this as well as for other employers. And so yeah, tell me a little bit about what you've been up to on your speaking circuit, I guess we'll call it.
Yeah, that's what I've called it. And again, I fell into it. What was funny was it was um, October of 22 or September of 22. I actually got acquainted with the Florida Alliance for Healthcare Value, and that is something I wanted to mention. There are co-ops and alliances all throughout the country that really help support employer groups really learn a lot about healthcare strategy. In my case, it was Florida Alliance for Healthcare Value. And somebody had introduced me to the CEO, and she said, well, we'd love for you to tell the Hendry Marine story. And my first response was in public. Because, a lot of us, we speak in front of our employees, we're comfortable, but I'm like, I was terrified. I'm like, it's frightening. I'm not going to talk in public. And that was when it started. And as a result of that, somebody found out about our, story and how we evolved the healthcare plan and the savings and the significance to, the bottom line and the employees. And there was another conference the following day. I got invited to speak on a panel. And then from there, it just started morphing. And my goal is to really be a thought leader. I've been watching a lot of Star Wars, so here's what I was thinking. I want to
Love
be
it.
the Obi-Wan Kenobi.
Yes.
of healthcare strategy for HR leaders, because really I was that person 10 years ago. I didn't know what I didn't know. I'm grateful that I took the path I did and opened my mind, because it gave me the opportunity to now pay it forward, through speaking engagements and staying involved with HR and now healthcare. So I really just want to give every HR person on this call, put an emphasis on empowering you to be bold enough to think outside the box and really, know that these changes can be made. But just make sure you're working with the right partner, and just it'll be okay.
Yeah. I love that.
I've been everywhere.
Yeah. Well, I know. Yeah, I've seen you on stage at U Powered a couple of times now. A couple of times now you've been on the U Powered stage, and
Yeah,
I know you've been invited to other conferences and
yeah,
things. And you're right. There are a lot of both regional as well as national kind of organizations that you can be part of that or at least that you can go to their conferences that you can learn from others. And yeah, I just think it's incredible. Well, and tell me about the one. There was one that just happened here recently where because I saw you in California just back in February, and you were speaking on stage, and I think somebody came up to you afterwards and said, "Hey, we want you to come speak at our thing that we've got going on
yeah,
in a couple weeks." Right? I mean, it just again talk about a
yeah.
snowball that turns into an avalanche.
It did. And again, and the thing is, I'm so passionate about it because I really want to keep bringing this topic to the forefront for my fellow HR professionals. But yeah, I was doing a session, and it was something new I created called Confessions of an HR Executive, because I want insurance advisors and professionals to understand the challenges HR faces, and how you can help us overcome those. So that was really the topic. And when I finished, I had someone from a company in California ask me if I was willing to come back in a couple weeks. So I did. And, from there met more people. And it just, I have events in July, August, September, October.
Wow.
It's wonderful. I'm just so happy to have the platform to keep getting out and speaking and, allowing an HR voice to be heard. So it's exciting.
Yeah. Well, and I think that's such an important point too that you just made is that a lot of times what I find, and again, correct me if I'm wrong here, but a lot of times what I find is that, HR is kind of caught in this rock and a hard place, right? Is, you know, you're by your rank and file employees, you're perceived as somebody who's part of leadership, and yet from leadership, they see HR sometimes, not always, but as something more of as a cost, and that is kind of a, it's something that's necessary, but doesn't necessarily, drive, profits or. So, anyways, you're kind of caught in between these two things where you're not viewed by part of either of those camps, but you're
Hmm.
also, you're integral to the liaison between those two and a kind of a bridge between those two. So it really is, and I think you said this on the outset when we first started, is that in many cases it's a very thankless position, and and I just want to underline that yeah, a lot of times it is, and but it doesn't necessarily have to stay that way, right?
No.
When you've been able to have this kind of impact, and now I would imagine your leadership trusts you completely with any tweaks or
Yeah.
any changes or anything that you want to do to this health plan. This is I'm sure they're on board for that. And I think at this point, having heard these stories about the employee who you were able to recognize the cancer and the
Oh,
high blood sugar, all these things, they obviously trust you
oh, yeah.
as much too. I mean, this has been a huge career enhancement to now. You literally have all these different conferences and all these events that are getting put on that are coming to you saying, Stephanie, would you come speak on our stage about what you did?
It's very rewarding to know that, again, HR has a voice. We're allowed to share it in the same format or forum as healthcare leaders or benefit advisors. So it is nice to have that opportunity. And, it is something I'm going to continue doing because it's that important because, you're right. HR is typically thought of as a cost center. And we don't have to be, because while we learn healthcare strategy and see it through a different lens, we have the ability to have such a financial impact to the bottom line, all while still providing better healthcare benefits for the employees. And they are things that, make the benefits more accessible. The premiums can become less, and you can make your own plan. I mean, it's phenomenal. I'm just so grateful.
Yeah, absolutely. Well, and so tell us a little bit about, some of these next speaking events you have coming up. If somebody wanted to come to one of those, or if you're going to be appearing on any additional podcasts. I know you were on Self-Funding with Spencer. That was one of my favorite episodes.
Oh,
I
thank you.
literally have listened to it like 3 times. And I know you've been on some others too, but if you've got podcast interviews coming up, speaking events that you're going to be doing, plug those, and any other way
Yeah,
that you want people to get in contact with you, or learn more about you.
sure.
What are some ways people can do that?
So LinkedIn is definitely one. I would love to connect with anybody that's been on, the session here with you. And, if there's any questions, I'm happy to help answer them or help guide. Next month, I'm actually on another self-funded with Spencer, but it's a live. And
Oh,
it's
okay.
women in leadership in healthcare. And now I'm like on the healthcare side. I'm lumped in with, so I'm on this live with Spencer and, his colleague Kristen Rivers and a couple other really great leaders and women in the healthcare industry. So there's four of us there participating. And then, different HR events, HR Florida in August. I'm actually going to be in the NABIB meeting for Tampa in October.
Okay.
Yeah, and EBN, which is Employee Benefit News, I'll be there in September, and that's in Vegas.
I will be there for that one too.
Oh, good. All right,
Yeah.
so I'll get to see you in a couple months. But yeah, I just, again, appreciate you giving me the platform to have the conversation about this and really empower my fellow HR folks to, think outside the box and know it's going to be okay with the right support and the right messaging and with the right leadership. You're going to be able to do it.
Indeed, absolutely. All right, well, nothing else to add. We'll end on that note. Stephanie, really appreciate you joining me today. This has been a great conversation. I'm really looking forward to continuing to learn more from you and see you out there. And again, for the audience, thank you guys for joining us again. Hopefully, you were able to get some value out of this. I'm sure there's a few nuggets, more than one. Hopefully, that you were able to glean from Stephanie here.
I
So.
hope so.
Until next month, I'll see you guys. Thanks again, Stephanie. Talk to you
Thank
soon.
you. Bye bye.